everyone, it's Dr. Joyce, Dermatologist, and I know I usually make skincare videos, but today I wanted to do a little bump date, I guess, because I'm 34 and a half weeks. I will show you my belly. Ooh! Okay, I'm too short. My belly doesn't even really fit in the frame. But I feel like it's been a while since I gave you guys an update because the last time that I posted about my pregnancy, I was kind of sharing my IVF journey. And now that, 10 plus weeks have passed and I'm kind of getting down to the wire, it's the last month, I figured I would do a little update and share with you guys some of my symptoms, what I'm experiencing, what I'm excited about, what I'm not excited about, and yeah, a little bit more personal video. I also thought about titling this video, and maybe I will, things that people don't tell you about third trimester. And I've been through this before. I have a 4-year-old son, so I was pregnant 4 years ago, but it feels a little harder this time. Maybe because I'm older. I'm 36 and a half now versus I was 32 last time with my son. Everything just feels a little more difficult, and I think it has gotten exponentially more difficult in this last month. So aside from just my belly getting really big, this time around I'm also experiencing sciatica. So sciatica is when, because of how large this baby is, she's pressing on my sciatic nerve, which is the major nerve that supplies innervation and gives off all the branches to your lower half, basically. And my sciatica manifests as this sudden shooting pain where I'll be standing or walking and then all of a sudden I can't walk. I'll step and then my leg will give out because of a shooting pain. And it's kind of embarrassing because I'm clumsy enough as it already is in pregnancy, but to suddenly kind of misstep or almost feel like I'm gonna trip, it's pretty embarrassing. So it happens when I've been walking for a long time or if I lie flat on my back and I get up. And so this is the worst in the middle of the night because I am a side sleeper. Typically, normally, when not pregnant, and during pregnancy, especially in third trimester, you're supposed to sleep on your side, but I inevitably sometimes end up sleeping on my back, and then because I have to get up in the middle of the night a million times to go to the bathroom, when I swing my legs off and plant my feet on the ground, I get a bad outbreak of that sciatica, and it always takes me a couple seconds of just stretching and retaining my footing, finding my footing before I can really get up and go to the bathroom. So the sciatica has been really different and difficult. And I think what has helped it is just trying to stay away from positions that cause the nerve pain, being more mindful of it, and trying to do some stretches. But it is a pain, literally, in the butt. Touched on this one a little bit already, but sleeping. Say goodbye to sleeping in your third trimester, which is really sad because really it's your last trimester to sleep before the baby comes, and then you'll never sleep again for 6 months. So you'd think that your body would want to store up on all that rest and really catch some snoozes, but sleeping is just really difficult. And so this happened to me during my first pregnancy as well. And my OBGYN recommended Unisom, which is an antihistamine that does make you drowsy. And so I've been taking a tiny dose of Unisom pretty much every night since I hit 31 weeks. I still wake up during the night multiple times, maybe 4 to 5 times a night because of discomfort with positioning or I need to use the restroom. But the Unisom makes it so that I fall right back asleep. So it helps me fall asleep quickly and fall back asleep quickly, even though I do wake up. Now, if I take a larger dose, sometimes I take a third, and with that, I'll still wake up pretty frequently, but then I can fall back asleep quickly. But if I take a larger dose, like a half pill, then that'll knock me out for the night. So sleep has been difficult. And to help with the discomfort, I have multiple pregnancy pillows, and they're funny because they have all different shapes and sizes. Some look like a G, some look like an upside down U, and you lie in the middle of it. I haven't found any of them to be particularly comfortable. So what I have been doing is I took my son's tiny pillow from his bed, and I've just been wedging it under my belly as I sleep on either side. It's not great, but let me know in the comments if you have a pregnancy pillow and and if you absolutely love it. 3, I've been experiencing a lot of hyperpigmentation or skin darkening. And we know that this is one of many changes that happen during pregnancy to your skin. And I'm gonna make a whole video on skin changes in pregnancy as well. But if you haven't seen my pregnancy safe skincare routine videos, I will link to those below. But basically, hormones that elevate during pregnancy can lead to hyperpigmentation as well as melanocyte stimulating hormone. And so if you guys have followed me on Instagram or TikTok, you'll know that I was in Oahu for a week about 2 weeks ago as a baby moon. And even though I was really diligent about my sun protection, I still, I guess, got some sun and like all my freckles came out on my face. You can even see it here. This is with some powder foundation on. Like every freckle I've ever had that was being kept at bay from being really careful about sun protection in Seattle, all of them popped out. So I'm like this spotty, freckly woman now. And not only that, but this didn't happen the first time, but I'm getting weird discoloration in other areas too. Like I got this speckly freckle pattern in the web of my fingers in my right here. And also I got a weird dark patch right here. Unclear why that happened, as well as over here. And other areas that do get darker in pregnancy, I also am experiencing, like in my armpits. Any skin folds really are getting darker. The weird thing is this time I'm not experiencing as much of a darkening of the linea nigra, which is the dark line that appears between your belly button and your pelvic bone. But I don't know why. Mine is just really light this time. Stretch marks. I have been definitely afraid of getting a lot of stretch marks because I'm really petite and my husband is not. So I'm 5 feet, my husband's 6'2", and my first baby was over 8 pounds. He was 8 pounds 2 ounces. He quite literally broke me when he came out. And so how this relates to stretch marks is the more your skin stretches, the larger the baby, the higher the chance that you're going to develop stretch marks. So this time around, I think I'm about the same size as I was the first time around, but I do feel like my skin gets itchier, it's red, and I am noticing stretch marks that I think have been around since my first pregnancy, but then after I shrunk back to my normal size, they were more flesh colored, so they weren't as noticeable. But right now, my stretch marks are all white colored, and I think after I deliver, I'm definitely going to start targeting them and treating them with body creams with retinol or retinoid, and I think centella and some other things that have actual evidence that can help treat red marks and white marks like stretch marks. There are other procedures you could do as well, like microneedling or laser, but I'm not that intense. And I'm really intolerant of pain. I'm also kind of lazy, and I'm gonna be in the postpartum period, so I'm probably not gonna be too aggressive with that. I'll just stick to topicals. Also, during this 3rd trimester, I've just been feeling more tired than I was in my 2nd trimester. I mean, 1st trimester, you really feel like you've been hit by a truck and you're like, I was exhausted by 6 p.m. every day. But now it's like, I just feel tired all the time. Part of it may be because of poor sleep. Part of it may be because I'm still trying to wake up from my drug-induced sleep with the Unisom, but I just have a general sense of exhaustion, just kind of all around. And also pregnancy mom brain is so real. Like sometimes my brain feels very foggy and I can't remember the names of people or places. And it's very annoying for someone who really relies on her brain to do my job. Like it's very frustrating being slow and not remembering everything that I want to all the time. But I know that this is temporary and this too shall pass. It surprises me every time how much it affects me. So that's a short list of things that have been troubling me, but things that I'm really excited about and looking forward to. We've narrowed down our list of names to just a very short list. And I don't know about you guys, but I had a fully long list. I like very feminine, very romantic, elegant, kind of old-timey names. And my husband, Matt, basically just likes one name, one French name. And it is kind of hard to compromise because he only likes one name and all the other names he's like okay with. So we've been having lots of discussions about it, and it's kind of exciting that we are down to a short list. And I feel like I know what her name is going to be, but maybe we'll wait to see what she looks like and be like, oh, she's a blank. So that's something really exciting that I'm looking forward to. I've also been getting into full nesting mode. Like, I've inherited tons and tons of clothes, swaddles, baby stuff from all of my lovely friends who have had daughters before me. And so today my mom and I sat down for a good 2 hours and just sorted through everything and sorted everything by size, by season, and just put them all in buckets and bins. And I'm finally getting everything organized. We're getting her nursery decorated, and things are kind of coming together. So I'm looking forward to that, like having her nursery be done. I have not packed my hospital bag yet, but I was thinking of making a video as I do and sharing with you guys what stuff goes in it. So if that would be of any interest to you, please let me know in the comments. So that is just a really quick personal update on how I'm doing. I know I usually talk about skincare and stuff on here, but I mean, this is a pretty big change in my life. And it's funny because when I am still working and seeing patients and doing Zoom meetings, if the Zoom meeting is like, you know, like from here up, people don't necessarily know that I'm pregnant, but then I'm like, oh, I'm actually 34 weeks pregnant. And sometimes people are really surprised. And it's like obviously a really big life change that affects me, affects my brain, affects my body, affects how I function. And I just wanted to share with all of you on here a more personal update this week. So you know what's going on in my life. I will go back to our regularly scheduled programming of skincare though. So I definitely want to take the next 6 weeks to make more pregnancy safe or just in general skincare videos about pregnancy, trying to conceive, breastfeeding, etc. all of these times. So if you have any questions, please leave them below. I would love to hear from you. And yeah, we'll be in touch very soon. Until next time.